We're going to begin this hour with a look at children and gun safety. The decision to charge the parents of the alleged gunman in the Oxford, Michigan school shooting with involuntary manslaughter has brought new attention to the laws surrounding children's access to firearms. Gun safety advocates want gun owners to be held criminally responsible in the event that they fail to properly secure their firearms. And members of the medical community are pushing for more funding to treat gun injuries and deaths as a public health emergency. Senior medical correspondent, that's Dr. Narula, spoke with a trauma surgeon at the center of that push, along with 3 parents who sadly lost children to firearms. Tara, this is such an important conversation. Good morning to you.
Good morning, Gayle. Those parents all say the deaths of their children were preventable. Gwen LaCroix's son, Jonah Payne, used an unlocked gun to take his own life at age 17. Kristen Song's 15-year-old son, Ethan, was killed while playing with a gun at a friend's house. Mark Barden's 7-year-old son, Daniel, died in the Sandy Hook school shooting. We were joined by Dr. Chethan Sathya, director of Northwell Health's Center for Gun Violence Prevention.
This isn't something that happened to us. This is our life now. I often say that I feel like my DNA has been rewired since Daniel was shot to death.
Waiting for the ER doctor to come in, we had no idea Ethan had been shot. I thought he had gotten hit by a car.
I was afraid of it for a long time because Jonah struggled with his mental health. I didn't fight hard enough. I didn't take a stand and say there are not going to be any unlocked guns in my home.
The gun Jonah accessed was registered to Gwen LaCroix's then-husband, who confirmed to CBS News that it was stored unlocked and unloaded in a separate part of the house from the bullets and in compliance with Michigan law.
Whether you're talking about accidental injuries or firearm-related suicide, either one is an exploration for a younger kid or another thing is an impulsive behavior. And why is it that we have, mental health issues in other countries, like Canada, Europe, are no different than here? But the lethality when you have access to a firearm is just exponentially higher.
Firearms are the leading cause of death ages 1 to 19, and 2/3 of those deaths are suicides. It's estimated 13 million kids in the U.S. live in a home with at least one firearm.
My son and his best friend were posting to social media on a fake account, and the detective said there was probably 100 kids who knew your son and his best friend were playing with guns and said nothing. And that is why it is our job to protect our children from themselves.
Following Ethan's death in 2018, the Song family successfully lobbied for a Connecticut state law strengthening requirements around safe storage of firearms in homes. Opponents in the state legislature called Ethan's law too broad, but it passed with bipartisan support, and a federal version has been introduced.
I was just asking basically to step up and make sure that people cannot get a hold of unsecured guns. 8 children a day are dying because they've gained access to a gun.
30 states and the District of Columbia have passed child access prevention laws like Ethan's law. A similar measure was working its way through the Michigan legislature at the time of the Oxford school shooting.
Do you think that this is something that is not on most parents' radar?
I think it depends on where you live.
Yeah.
There are families who live with this every day as part of their reality, and unfortunately they're not getting the support and the attention that those of us who have suffered high-profile tragedies.
For more than 20 years, federally funded research into gun injury prevention was prohibited. In 2019, Congress lifted that ban. Dr. Sathya is among the first to receive NIH funding to study the root causes of gun injury and death.
Obviously, this is an area that was not funded for a very long time. What did that do to our understanding of firearm safety?
If you look at the leading causes of death, whether they be heart disease, motor vehicle collisions, cancer, firearms have always been at the top, and they receive less than 1% of the funding of those other diseases.
I feel frustrated that we continue to come forward with our stories, and the inaction continues to make Jonah's loss even worse than it already is.
Our research right now that's funded by the NIH is focused on asking every single patient who comes into our hospital questions related to firearm injury risk. And so we're actually using a model that we use for substance use, where we started asking everybody. That's what helped normalize those conversations. And then if you screen positive for access, you're going to get gun locks, firearm safety counseling, And if you screen positive for violence risk, you're going to get violence interrupters, community resources to hopefully break that cycle of violence.
How do you feel about gun ownership?
I have no problem if someone owns a gun against negligent, reckless behavior.
I would like to see there be consequences for gun-owning adults who allow children to get a hold of their guns and either hurt themselves or someone else.
I mean, we work with a ton of gun owners. Gun-owning parents are even more appreciative of having that conversation because they really understand the importance of safety.
I've found that most gun owners that I speak to identify as responsible gun owners.
I mean, all three of us, it's a safe storage issue. In all three of our situations, the gun could have been stored in the time it takes you to take one breath.
What have you learned about the incidents that you've prevented through Sandy Hook Promise?
School shootings, mass casualty events that someone says something over social media or in passing to somebody in school, if that individual is trained in our Say Something program, they know exactly what to do. And they can tell a trusted adult who can get that person help.
How do we humanize this and keep the faces of your children present and all the children that have been lost so that it's not just about statistics and numbers?
I always have pictures of my little Daniel to look at the face of my sweet little 7-year-old boy who was innocently in his first grade classroom when he was shot to death. And if that doesn't resonate with you.
My youngest James was 3 when Jonah died, and he doesn't remember Jonah. It's very difficult to grow through that, and to understand, and to not have that big brother to guide you.
I really walk people through Ethan's day. I want them to viscerally feel what it's like to have your son tell you about all his hopes and dreams. And then, you know, an hour later, he's dead. I want people to watch the ER doctor literally slide down the wall and put his head in his hands and whisper, "Your son is gone."
As a pediatric trauma surgeon who's had to walk into that waiting room and deliver news, impossible news to families, how does hearing this make you feel?
I mean, this is, you know, a preventable crisis that we are doing nothing about. It makes you feel helpless.
What do you hope the legacy of your children will be?
Take a few minutes to learn about our children, get to know them a little bit, and hopefully folks will understand what's at stake and what can be lost.
I'm working with my community and really building up our healthcare system to face this public health crisis in the same way that we've met the pandemic.
You know, I always tell people, we don't get vacation from this. There's no hump day, there's no TGI Friday. You all will go home to your lives, you'll kiss your children. We're gonna go home to an empty bedroom.
All 4 of our panelists describe the tremendous ripple effects, including the significant disability and chronic injuries that come from non-fatal firearm injuries, and the psychological damage to entire communities and families, including thoughts of suicide and despair.
First, thank you to those parents for talking so candidly about something that is so painful. I was very surprised to hear in your piece the leading cause of death for children between the ages of 1 to 19. And I've seen parents who have been in situations where they've lost someone so tragically, anybody, and they say it's not about moving on, it's about moving forward. What do these parents say about how they get through their days? They were all so compelling.
So strong. And, you know, Kristen said the trauma is truly intense. And I think for them, the strength comes from the idea that they might save another child. The strength comes from honoring the children that they lost and also being there for their surviving children. You know, their children have helped pull them out of the darkness. In fact, Kristen told me, you know, she was suicidal at one point and her surviving son, Evan, looked at her and said, "Mom, you know, you're not going to hurt yourself, are you? Because if you check out, I'm going to be right after you." And, you know, she said in that moment, I realized I had to survive and fight for my children and my family. So the ripple effects, the concentric circles, it just goes on and on.
Huge.
Where they find the strength.
Yeah. And the point was made that there is not a tension between storing it safely and getting access for the reasons you have a gun in the first place.
Exactly.
That's important.
Exactly.
Doctor, thank you very much.